Good afternoon, everyone. My study is on bacteriophages. That's a novel approach to combat multi-drug resistant Pseudomonas. It's an efficacy of a phage cocktail against multi-drug resistant Pseudomonas in corneal models. As you know, corneal blindness is the second most common cause of visual loss in India and most of the developing world. And infective keratitis is one major cause. And Pseudomonas is something pretty nasty. It can involve the whole of cornea in even within 24 hours. It has multiple collagenolytic enzymes. It causes rapid spread. It also has a biofilm. It is motile. It can go deep into the stroma quite fast. And it has multiple factors which contribute to the intrinsic resistance, in addition to the regular antibiotic extrinsic resistance that you see. So Pseudomonas multi-drug resistant 1 is classified as one of the escape pathogens. And about 30% roughly are having antimicrobial resistance. And some of the series, it is close to 48%. So phages are viruses which need a host bacterium. So these are pretty specific to species. And there have been uses of phages for cystic fibrosis and otitis media, and isolated case reports in corneal infections. So our team at Amrita Biotech had identified these phages. This is a made in India phage. So most of the phages are imported from Georgia. So this is from the multiple water sources in Kerala. And they found that it is pretty effective. As you see in this slide over here, the plain one is the Pseudomonas culture and other one is the one with the phages. You see multiple speckle pattern. So, and in their study, they found that the multiple phages were isolated, AMP 2 to 9, and they found that a combination of 2, 4, and 5 is the most effective one against the multi-drug resistant Pseudomonas. So, aim of our study was to evaluate the efficacy of this cocktail against multi-drug resistant Pseudomonas. So, this multiple methods were used to basically collect that phages and concentrate it well, enrichment broth, then centrifugation, which I'm not going to the details. Then the bacteria were filtered out. So there is a protocol laid out by Case et al. For double agar overlay to have the phages grown. And basically, the samples were incubated and again centrifuged, and phage pellets or concentrated phages were made. So the most effective phage cocktail, 2, 4, and 5 in the ratio of 1:1:1 was used. To produce the corneal infection, we made from the cadaver corneas, we put it on the DMAM agar, 1%. Once it is solidified, it was reversed. It is also well described, I think, by the team from Britain. It was a 24 mm, it was put in the 24 mm well. It was filled with DMAM. And then multiple scratches were made, and Pseudomonas culture was put for about 3 hours, following which the phage cocktail was kept on the cornea within the well for about 10 hours overnight. So at the end of the next day morning, it was homogenized, and the resulting suspension was spotted on LB plates for colony enumeration. So 4 corneal buttons were used, 1 in each pair serving as a control. And this was done in multiple concentrations also. So when we look at the pairs, the first pair showed this large opaque colonies, flat ones, and in the phage treated it was virtually absent. Similar result in the second pair also, and only in 10⁻⁴ concentration we could see that some of the colonies were there. Third pair also, something similar, and also in the fourth pair. So there is some green color, most likely Pseudomonas pyocyaneae. So we found that about 90% reduction in the colony forming units were consistently seen in all 4 pairs compared to the controls. And it was seen to be highly effective in killing the MDR Pseudomonas. So these are a group of, MDR Pseudomonas is a group of pathogens which really need novel antibiotics. And as industry is shying away from investing in newer antibiotics, we have to look beyond other agents. So this particular cocktail, which was sourced from India, it is helpful and is found to be effective against MDR Pseudomonas. I would acknowledge to our Amrita Biotech team who has done this phage isolation. Thank you.
Very nice work, Dr. Radhakrishnan. So one question, what is the impact of these phages on the cornea per se?
Okay.
Is it known?
So,
Because you used-
No,
it was-
we really, I think safety studies really have not been done on the cornea. That is true. But people have compassionate use has been done, even in pneumonia and all that it has been done. There is a CPT, compassionate phase trial. They import it from Georgia and use it. I think that's based in Bangalore. They are using it actually, and I think it is quite often used by infective medicine people. Not very much in cornea. That is true. So they say that I think just like in soil you have a lot of bacteria and a lot of viruses. So usually phages really outnumber the bacteria that is present. So that is there in every surface. So even in cerebrospinal fluid and peritoneal fluid and all, they have isolated phages.
Thank you.